Hi, my name is Matthew Fien, and for this Practice Inspiration segment, we're going to be talking about soft tissue considerations around dental implants. More specifically, techniques that we can use to maintain marginal soft tissues when we're placing immediate implants and temporization, but also when that's not possible. Aesthetic implant rehabilitation requires careful diagnosis, treatment, and execution. Many cases like this require multidisciplinary care, but there's so many things that we have to look at in order to achieve optimal aesthetic results. In the ideal scenario, we're able to place our immediate implants and immediately temporize our implant prosthetics at the time of placement. This requires atraumatic extraction, intact or nearly intact buccal plates, immediate implant placement, bone and or soft tissue grafting, and then restoration with an implant-supported temporary prosthesis. Unfortunately, not every case can be treated this way. How do we manage cases when we can't place our implants immediately, or when we don't have enough primary stability to place a temporary abutment on our implants? Today we're going to talk about lots of different ways that we can help to maintain the soft tissue contour around our implants, but for me, the most important take-home point is that we need to do everything possible to avoid affecting the marginal soft tissues. As you can see in this case, I went with a vestibular approach to attack that buccal fenestration defect. I was still able to place my implant and do my bone grafting without touching that marginal soft tissue, which is so critical. As you can see the healing at 2 weeks, we have great healing of the soft tissues, and we haven't affected that marginal tissue. As you can see here, I used a removable partial, and this is something that I do quite a bit. Now, it seems very obvious when you look at this picture that that tooth seems to fit pretty nicely into that edentulous site, but this is not usually the way these cases present from the lab. It takes that extra step of communication to make sure that you and your lab are on the same page. If we're trying to insert a partial, like the ones you see here, with pink acrylic pushing into that marginal gingiva or occupying the space where we want our tissues to be present, we're going to have a hard time with final aesthetics. You can take a look at the lateral incisor and see what the normal anatomic shape should be. And you can clearly see that with this temporary partial, we're going to have some issues. On the other hand, if you take a couple of extra minutes when you're delivering your partial or when you're communicating your cases to the lab, you can actually start to develop your soft tissue architecture at the time of implant placement, regardless of whether or not you're going to be placing a temporary restoration on that implant. In this case, I was actually using a healing abutment, not a cover screw, and I'm still able to help to start to build that soft tissue architecture. As you can see here, I delivered the immediate partial directly after implant placement. I thought about adding some acrylic material to the cervical aspect of this pontic, but this case really exemplifies the need to allow biology to do its thing. As you can see, after just 1 to 2 weeks of healing, we have really incredible atraumatic healing, and we're able to maintain that interdental marginal soft tissue, which is so critical for final aesthetics. Here you have the occlusal view of the same case, and this gets me thinking. Using a healing abutment at the time of implant placement is pretty mainstay. There are some advantages, but if we really want to get the maximum advantage to doing one-stage implant therapy, we should really consider starting to manipulate and mold those soft tissues at the actual time of implant placement. And this can be done by using custom abutments, which we'll talk about shortly. In another example, you can see immediate implant placement number 8 with that same healing abutment in place. And while we get a nice result and nice thick anatomical contours, we have to go through the process of preparing and creating a temporary prosthesis before we feel confident that we'll have that emergence profile that we're looking for in our final crown. In other cases, we are just not able to use an immediate placed implant because, for instance, in a case like this where we have severe bone grafting that's needed prior to performing our implant prostheses. I used the partial that the patient had fabricated prior to the procedure, and actually, since the partial fit pretty well, I was actually able to use this partial to now create an implant-supported temporary. Because of the nice fit that this partial had to begin with, it really saves some time and allows you to create a pretty predictable restoration as a temporary, which will help to develop the tissues moving forward. In many cases, like I had mentioned, we're not able to really create and to develop the soft tissue architecture until the implants have healed. In this case, what I ended up doing was creating a standard impression of this implant, took it to the lab, and then evaluated the anatomy of the gingival architecture. As you can see here, the emergence profile of a central incisor ought to be triangular. We have to take that round implant platform and convert that to this triangular appearance. One of the easiest ways for me to do this, like I mentioned, is in the lab. So I'll prepare on my stone model the ideal emergence profile. I can use a temporary abutment made out of either PEEK or titanium, and then with the use of composite or even acrylic, create the ideal tooth shape. This is something that dentists like myself do each and every day. By using a standard abutment with the proper curvatures, we can now be confident that our soft tissue architecture will mimic nature. As you can see here, I inserted the temporary abutment into the implant, and you can see the blanching of the tissue, pushing that tissue to where it needs to be, or tissue training. This is the delivery of that immediate temporary crown. And as you can see, there's still some blanching, and we have some open spaces, some black triangles between our teeth, which is another very important point in terms of patient expectations. We did pretty well in this case, as this patient suffers from a history of moderate horizontal periodontal bone loss. But if you were to take a look at the preoperative pictures, you'd see this is a significant improvement, and we're starting to mimic nature. Now, it's very important that we try to start training our tissues as early as possible. While I mentioned the best way to do this is with an immediately loaded temporary restoration on our implants, that's not always possible. One of the tools that I like to use in my practice, as opposed to using a standard healing abutment, would be to use a customized healing abutment to help to train our tissues. And there's several good ways to do this. This is a prefabricated healing abutment that we can purchase that is pretty standard. So for a central incisor that needs that triangular emergence profile, we can place this healing abutment at the time of surgery and start to develop those tissues right away. This product can also be used for other areas of the mouth. And depending on the specific tooth that we're going to replace, there are different sizes of these products that we can use. The biggest issue I have with a preformed shell, just like the ones you're seeing here, is that depending on your implant placement, a good amount of modification might be needed. Alternatively, I would prefer to create my own customized healing abutment right at the time of extraction and implant placement, if possible. There's some important factors that you need to consider, but in general, I think that creating your own customized healing abutment can be very successful and very simple to do. Here's an example of a case where we extracted tooth number 9, we placed our conical connection implant, and this is a very cool system because this system comes with a connect abutment, which is an abutment that's designed to go into the implant at the time of placement and is designed to be left there forever. What this means is we're not interrupting that contact between the soft tissues and the connect abutment. So we don't have a bleed later on, and we're keeping that bond as strong as possible. And the whole goal is that we'll be able to maintain that soft tissue to implant contact In this case, we used a connect abutment, and then we used a titanium cylinder that gets inserted directly into that implant. Using composite or acrylic, I like to use a shell if possible to help to create that emergence profile. This is a very, very simple way to create the appropriate emergence profile and allows you to make some modifications depending on your implant placement. As you can see here, I actually performed this one on the bench top and then spent a good amount of time polishing and creating the proper anatomy for us to be able to deliver this immediate healing abutment at the time of implant placement. As you can see here, even though I'm using a healing abutment that's customized at the time of implant placement, I still need to give a patient a tooth to go home with. And so we use those same principles that we discussed earlier about modifying our partial to fit perfectly into that gingival contour. As you can see, the healing here at only 1 week, we have complete maintenance of the interdental soft tissue and a very, very happy patient. The final step, after we've done all this work to maintain our soft tissue around our implants, is to transfer this emergence profile to the lab. This can be very simply done by modifying some open tray impression posts, customizing them based on the temporary prostheses that we have prefabricated. And now we have great communication with the lab, and they can mimic that same soft tissue architecture that nature gave us. Thank you for your time, and I hope to see you again.